Sales Manager from 𝑤𝑒𝑏𝑒𝑠𝑖𝑡𝑒. Today, I'd like to share a video of how to using 𝑤𝑒𝑏𝑒𝑠𝑖𝑡𝑒 Piezo surgery. And here we got the first generation of 𝑤𝑒𝑏𝑒𝑠𝑖𝑡𝑒 Piezo surgery. Let's open it. Okay, first we can see some accessories above the box. Okay, and here we can see the main unit. And we are going to install the device. Okay, we take out the main unit. Okay, and here you can see this is a pump, and we can notice this place, and we are going to fix a pump here, and we can notice there is a gap here, and we just match this gap with the convexity. Okay, we match them together. Okay, and then we rotate gently. Okay, so first we have to match them together. Okay, and then we are going to rotate. Okay, we just rotate, and it will get stuck, so it is fixed. And pay attention, you can see this part it must on the right side, it cannot on the left side. So here we have fixed the pump, and if you are going to remove it, you have to press this part. You can see you have to press this button and then rotate, and you can take it out. And we just rotate gently to fix it. So here we have put on the pump, and now we can see here this is the foot pedal, and we are going to connect the foot pedal. And you can see here is the connection. We put on the foot pedal. Okay, and we have to screw this part. Okay, so we connect the foot pedal and also the power supply. Okay, power supply. Okay, power supply. And we connect the power. And here you can see some other parts. This is a saline water hanger. You can put it here, and we will hang on the saline water here. And this is the handpiece holder, and we can put it here. Matches this with the hole. Okay, and we get a rubber block, and we can put the handpiece here. And you can see here a set of tips. Okay, and this is torque wrench, and put here. And here we have a metal box, and let's open it. And we can see there is a handpiece, but pay attention, the whole handpiece, it is a whole system. It means we cannot separate the handpiece. And when you are going to autoclave it, we can put the whole handpiece for autoclaving. And we are going to put on the handpiece. Okay, so first you can see a red spot here. And you can see here, the collection part, there is also a red spot. We match the red spot together, and we push into the collection. Okay, and we can put the handpiece here like this, and we can also hang it here. Okay, so we put the handpiece, and this is the pipe, and this is the pump. We can open it, and then you can see this is a pipe. There are two parts. This part is bigger than this part. We just notice we have to put the pipe into the pump, and we should put like this way. You can see like this way. We cannot put in this direction. It is wrong. Okay, so we'll put it this way. Okay, we put it properly, and then we close it, and we can hang on a bottle of saline water and we just insert into the saline water. And here we can use this instead of saline water, and we will put it here. Imagine this is saline water. Okay. So here we finish the installation of the whole unit. Okay. And now that's the first part, the installation of the whole unit. And the next part, we are going to talk about how to use this machine. Okay, and turn on this side, you can see here. And here we can see this is switch on and switch off button. We turn on the unit. Okay, and we can see some buttons here. After we turn on the machine, you can see here it is bone mode. You can see BON bone. Okay, this is the first mode when you open the machine, when you turn on the device. And this screen is very easy. You can see this block, it's indicating the power supply. And this block is indicating the water supply. And how can we change the power supply? We can use this button. You can see 1, 2, 3, S. We can use this button. When we press here, you can see the power supply is reducing. You can see here. And what kind of power supply should we choose? Usually we just choose the highest power supply. We want the Piezo surgery to cut more quick, so we just choose the highest power supply. And sometimes if we are cutting the cancerous bone, you can reduce the power supply. Most cases we just set it at the highest power supply. So that's about the power setting. And this is the water, and we can use minus and plus button to change the water supply. And what kind of water supply should we set? And we must know when we are doing the surgery, we use the water for cooling. So to make sure the cooling effect, we must set the water supply no less than 3 level. It should be at least 3 level. And if you are going to cut deeper, or you are cut some place where the water is difficult to get into, you should increase the water supply. You can see here. So the water supply should be at least 3 level. So yeah, that's very easy. We just set the power at the highest and water no less than 3 level. That's enough. And this is a bone mode. More than 90% of surgeries we are doing under this mode. Okay, I think this is very easy. And now we are going to change to the second mode. We can use this mode button to change the mode. Okay, we press it. Now you can see it is root mode. And under the root mode, there is 2 functions. One is the perio. The perio, it is, I can show you a picture for perio function. What is perio function for? You can see here, we will use this kind of tip. We can use this kind of tip for periodontal gentle keratin scaling. You can see here, sometimes there may be some necrotic tissue, and we can use this kind of tip to scrape on the surface of the bone to clean some bad tissue. And we know the scaler also can do scaling. And what's the difference between this perio function between the scaler? And the difference is that we use the scaler, ultrasound scaler, for cleaning the dental calculus, but we use the Piezo, the perio function, to clean some bone tissue. That's the difference. Piezo surgery, the perio function is to clean some bone. So that's the difference. Okay, so this is a perio function, and we can use this button to change to the endo function. Endo function, it is designed for retrograde root surgery. And we can show you another picture. You can see here. Sometimes there may be some problems at the root, and we don't want to extract the whole tooth. Then we can use some kind of tip. You can see we can use some kind of tip to cut a window here, and to expose the root of the teeth. And then we can use we can use the Piezo surgery tip. We can use a Piezo surgery tip to cut 3 to 4 millimeter of the root, and then the root canal it is exposed. And we can use another tip. You can see here in the picture. We can use this kind of tip to insert into the root canal from the bottom to prepare the root. Okay, and after preparing, we can fill MTA and some other materials, and then we can close the window. So the E mode, that is endo mode, it is designed for retrograde root surgery, especially for this kind of tip to prepare the root from the bottom. So the P mode is for periodontal surgery to remove some bone tissue, and the endo mode it is for retrograde root filling surgery. And here is the power supply. You can use plus and the minus button to change the power supply, and this we can shift to the water supply. Use the minus and the plus button to change the water supply. When we are using the P mode and the E mode, and the power supply and the water supply, we can use a medium level. So that's for peri mode and for E mode. And sometimes if you forget how to use this mode, it doesn't matter, because you can ask from our local distributors how to use this function. So this mode it is seldom used. So that's the second mode. Okay, now let's change to the third mode. We can press the M button again. You can see this clean mode. We have to know when you are doing the surgery, we are using the saline water. After surgery, we have to clean the saline water out of the pipe, because if saline water is remained in the pipe, it will crystallize, and then the handpiece may get blocked. So after surgery, we have to change to the clean mode, and then we can work like this way. You can see here. You can see the screen. You can see the screen here. It indicates that press the foot switch to start the clean mode. So you can see here, we just take out the plug from the saline water, and here we have a cup of purified water or distilled water. So we change from the saline water. Okay, to a cup of purified water or distilled water. Okay, and then we just we press the foot button. Okay, to activate the clean function. You can see we press, and then you can see the screen. It will run automatically for 25 seconds. You can see here. Okay, and you can see the screen. So we just press foot switch to activate the cleaning function. Okay. So what happened just now? Just now we are changing to the clean mode, and then we press the foot switch. We press more than 3 seconds, and then it will activate the clean function. And the pump will push the clean water, go through the whole water system to drain out the saline water. So that's what we do just now. Usually the whole circulation is 25 seconds. So that's the first circulation. After the first circulation, we have to take out the plug from the distilled water or purified water, and we put here. We don't put it in the water, we take out, and then we change it to clean water again. So now we press the switch to activate the clean function again. Okay, and now you can see here the remaining water is drained out from the pipe. Okay, so you can see there is no water come out. So the second circulation is to clean out the water from the whole water system, and you can see the countdown. Okay, so after each surgery, we have to repeat for twice. The first time we clean out the saline water. The second time we clean out the distilled water from the water system. So this is what we do after each surgery. Okay, and then we can open the pump. You can see, open the pump, take out the pipe, and we take out the handpiece. We can take out. Okay, and then we can open this head. We open it because when we are doing the surgery, sometimes the blood maybe get into inside. So we open this part and we check here. Okay, we check whether there is some. Okay, we check whether it is get dirty or something. Okay, and then we can use a cotton. We use cotton, dip some alcohol to clean inside this part and this part, and also we can clean this part. And here is a LED lamp. You can see here. We can also take out, and we can clean this part, and then we can put it back. And when you are put back, you have to pay attention. There is some mark here. Here is the plus mark and the minus mark here, and also here is plus mark and minus mark. We match them together and then we put back the LED lamp. After cleaning these parts with alcohol or with distilled water, we put it back. Okay. So after surgery, we have to open this part and check whether it is polluted inside or not. Okay. So and then we can use some clean water to wash the handpiece, and we clean the handpiece. After that, we put everything. You can see here, we have put the handpiece inside the box, and also the tip set into the box, and top wrench, and this rubber block inside. Okay, and also the tip holder inside. Okay, we can put them in order, and then we can close this, and then we can pack it this metal box and put it into the sterilizer for autoclaving. So that's how we autoclave the handpiece. Okay, so now we put it back. Okay, so here we have introduced how to install the device and how to change the mode. Okay, now we are going to put it back. Okay, handpiece, and we can check again. We match the red spot together with the red spot. Okay, and put handpiece, and we put the pipe into the pump. Okay, so now I think we know how to install the device and how to operate. And you can check it here. You can check the screen. The first screen is the bone mode, and more than 90% we are using this mode. This is for root mode. We can do for periodontal surgery and for retrograde root surgery. So two functions here. They are seldom used. And the last mode is for cleaning the handpiece. I have showed just now. So now we know how to use the device. And the next part we are going to introduce the tips. Actually, when you have bought the Piezo surgery from the packer, you will have lots of tips. And how could I know which tip I should choose? Because there are so many tips. So to make it more easier, we can divide these tips into different groups. Okay, this is okay. So we can divide the tips into different groups. Okay, so you can see here. Now we have divided these tips into 4 groups, and here is the first group, and let's see the tips. You can see what's the features. You can see they have some sharp teeth. You can see here have some sharp teeth. And if we see clearly, you can see this tip, it has 4 teeth here, 4 teeth here. And this tip and this tip, you can see here, this tip it have 5 teeth here. So that's one difference. And the second difference is that you can see here from this direction, you can see here, you can see this tip is very thin and this tip is thicker. Imagine if you are going to cut deep, which tip is more easy for you to cut down? Of course, the thinner the better. So that's the difference, the main difference between these two tips. The thinner tip we can cut down, can cut deep, and the thick tip we just cut on the surface of the bone. That means cortical bone. So that's the difference. Which tip you should choose? This one to cut the surface. This one we can cut the surface of the bone. We can also cut down, and it's very thin because it's very thin. Because you have to use this tip to cut down. So you can see some dots here. You can see here. You can see 3 dots here. The first dot is 7 mm from the top of the tip, and the second dot is 8.5 mm from the top of the tip, and the third dot is 10 mm from the tip. So when you are cut down, you can check the dot to know the depth of the tip. Okay, so that's the difference of the first 2 tips. They are for bone cutting with sharp teeth. And we also have some other tips with sharp teeth. All of them are designed for bone cutting with sharp teeth. And we know what's the difference between these 2 tips, I think. Okay. And the second group of tip, you can see the design. You can see it is much more thinner. And you can see it's like a slice of blade, which is very thin. And what is it used for? And let me check. We can use this tip to cut between the teeth and the bone. So we can use this tip to cut up and down to separate the teeth with bone. Up and down to separate the teeth with the bone. Because it is very thin, so it can very easily cut into the gap between the teeth and the bone. Okay, and sometimes if there is residual root, it is very difficult to use some other tools to get out the residual root because the other tool is too big to get into this part. And then you can use this tip to remove the residual root. And also sometimes if there is a failure implant, you have to remove, and we can use this tip to remove a failure implant, because if you remove a failure implant, you have to place a new implant here. So we must save the bone as much as possible. And then we are going to use this tip to remove the failure implant. The advantage is that it can save the surrounding bone as much as possible. Okay, so this we can separate the bone with teeth, and also can remove residual root and implants. Okay, and they are very thin, just like a slice of blade you can see here. Okay, and the third group of tips you can see they are curved tips, and this is flat and this is round. And what are they used for? You can see here. Sometimes if the bone is not smooth, you can use this to scrape on the surface of the bone to make the bone more smooth. For example, if you are going to place an implant here and the alveolar ridge is not smooth, you can use this tip to scrape on the surface of the bone. And what's the difference between them? This will scrape more place, and this will scrape less place. So these tips we can use to scrape the surface of the bone to make it smooth. And also sometimes we can use this tip to collect some bone from the patient. We can scrape some bone and then we can collect the bone from the patient. Okay, so that's how we use these 2 tips to scrape the surface of the bone to make it more smooth. And another tip you can see is this design with a diamond coated. You can see here And what is this tip used for? You can see here, if you have removed a cyst here, and this is a cavity, you can use this tip to clean the cavity, clean some bad tissue from the cavity. And sometimes after extraction, you can also use this tip to clean the extraction point. You can see here. So we can use this to clean the cavity, okay, after removing a cyst. And another function is that for sinus lifting, you can see sometimes if you are going to do the direct sinus lifting, you cut the bone, and as a last step, there is a very thin bone you can see here. If you are still going to use this kind of tip, you cut this thin bone, you may hurt the membrane below the bone. But if you are going to use this tip to cut the bone, because it is diamond coated, so we can cut like this way, circle by circle, and then it is very safe. It won't break the membrane below the bone. So we can use this for safety cutting the bone. Okay. So here you can see we divided the tips into 4 groups. The first group with sharp teeth for bone cutting. Second group is like a blade. It is for separate the teeth with the bone. Third group scrape the surface of the bone. And the fourth group, we can clean the cavity or we can cut the bone very safe. Okay. So here, I think now we know how to choose different kind of tips. And now we know how to choose different kind of tips, and it won't be a mess now. Okay, so that's the third part, how to choose different kind of tips. I just introduced some tips. Actually, there are hundreds of tips from the packer, and you can divide them according to the shape. You can divide them. Okay, and now we are going to introduce the next part, the fourth part, how to operate. Some dentists will say the Piezo surgery is very slow. Actually, the Piezo surgery, it is quick or it is slow. It depends on how well the dentist know how to use the Piezo surgery. Okay, so here we are going to put on the tip. You can see here we put this bone cutting tip. First, we just screw like this way, and then we can use the torque wrench. We get into stuck, and we can screw with force. Pay attention. When you are tighten the tip, you must hear the click sound. You can hear. When you hear the click sound, it means the tip is fixed. You don't worry, it will damage the tip because the force is limited. So when you are tighten the tip, you must hear the click sound. When you hear the click sound, it means the tip is fixed. Okay? And now imagine this is a bone, and we are going to cut the bone. And we will hold the handpiece like this way. You can see here. And this is the bone. You can see here. And when we are introducing how to use the Piezo surgery, we can use this cover from a bottle of water, and we will work like this way. Before we are going to cut, we have to know what kind of force we should give, and we can use this tip on the dentist. We can let them to feel the force. We press when they can feel some pain. It means the force is enough. If it's too loose, it is not correct. And if we push too much, and it's also not correct, we just give proper force. They can feel some pain. That's enough. Feel some pain. That's enough. Okay, so now we know what kind of force we should give first, and then we can. This tip is for bone cutting, right? We will cut like this way. You can see, move like this way. We move in a line. You can see, and we move in one direction. Usually we don't move like this way, left and right. We move in a line like this way, and we just move in one direction. We don't move back and forth. We just move in one direction. Okay. Now I will show you. You can see here. Okay. It takes some time for the water to come out. You can see 1, 2, 3, 4, 5, and you can see the surface of the gap. You can see here. Usually, if you are operating correctly, you cut one time, it will cut about 0.5 millimeters. Okay, so you can see here, and we are going to cut through. You can see here, 1, 2, 3, 4, 5, 6, 7. Okay, we have cut through. You can see, cut through the cap. You can see here. So this is how we use Piezo surgery for cutting bone. Let me show you again. We will cut like this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So we will cut like this way. We repeat and repeat again. So you can see we cut through the tip. So it is very efficient if you know how to operate correctly. We just cut like this way, repeat and repeat again, in a line, and we put it flat like this way. Don't work like this way. Put it flat and then move one, repeat this action, and then it will cut through the bone. It's very easy. Okay. When you are operate on the patient, well, sometimes you can cut a bone like this way. Cut some bone, you can see like this way. It's very safe and very gentle for patient, and also very safe because the Piezo surgery, it won't cut the soft tissue. I'll show you. You can see, they won't cut the soft tissue. You can move quickly. They won't cut the soft tissue. Okay. Okay, so now we know how to use the Piezo surgery for cut bone. That's the first tip I'd like to show you. And the second tip, now we change to this kind of tip. As we told before, it is used for separate teeth with bone. Okay. And how we use this tip? I will use this, show you again. This tip we will work like this way, up and down, up and down, up and down. Okay, let me show you. You can see here it is okay, up and down, repeat up and down. You can see. Okay, you can see. We have cut through. You can see here. Okay, we will repeat up and down, and then you can see we have cut through. Okay, let me show you again. Up and down at the same point. You can see it's very sharp. Up and down. Okay, and you can see here. Okay, now we are going to remove a teeth. I'll show you. You can see if we are going to remove this third molar tooth, and now I show you. First, we will cut gingival, and then we will use this tip cut between the teeth and the bone. We move along this part. Usually, we don't cut the lingual side because on the lingual side there is some nerves, so we don't cut this part. We just cut the tip side, the lip side, this part. So we can use this tip on this side. Okay, I'll show you. Okay, up and down, up and down. I'll show you here. And you can see up and down, mouth up and down. And you can see we have created some gaps here. You can see here. So pay attention. When you are use this tip, we must work like this way, up and down, up and down. We cannot work inside and don't take out the tip. Must work like this way, up and down, up and down, up and down, and then move along this side. You can see here. Okay, now let me try again. Okay. Okay. So up and down. Okay, and when you are cutting, the deeper the better, because the tip is very long, so we can cut deeper. You can how deep it is. You can see here how deep it is. Now you can see. Let's see what happened here. you can see there is more space here, and the tip and the teeth and the tooth is more loose now. So after this operation, then we can use the dental, you can see, elevator more easily. It will have space and the tip is more loose. We can remove the teeth more easily, and it will cause less damage and less pain to the patient. This bone will be more saved, you can see here. So that's why we use the Piezo surgery for remove the teeth. Okay. So now we know how to use the tip for bone cutting. Move like this way in one direction, and we know how to use this tip to separate the tooth with bone. Okay. And the next tip I'd like to introduce, okay, are the curved tips. I'll show you here. So we put on this tip, okay, and okay. So now you can see the surface of the gap. It's not smooth. I use this tip show you. And see, you can screw on the surface of the tip. You can see here. So you can see here. I use this to scrape on the surface and to collect some bone. You can see here, something like this. So that's how we use this to scrape on the surface of bone to make it more smooth. Yes, just scrape like this way. Okay, so now we know how to use the Piezo surgery, the tips, and once you can operate correctly, it will be very useful to help you in surgery. And when you are going to use the Piezo surgery, make sure you have tried on this material, or you can try it on the gypsum dental cast. You can try it because seeing and listening is totally different from operating. Once the doctor or dentist they tried, they will have a direct feeling by themselves. Just watching or just listening is of no use. So when you are going to promoting the Piezo surgery, we must invite dentists to try by themselves. No matter who he is, we must make sure to let them try. And you can check how well they can cut in, and check whether they have operated correctly or wrongly. So that's about operating the Piezo surgery. That's the fourth part. And the fifth part, I'd like to introduce why we are using Piezo surgery, because we know we can also extract the tooth without Piezo surgery. So why we have to use a Piezo surgery? So let me tell the reason. Usually for some simple tooth removal, we don't have to use the Piezo surgery because it's very easy. We just use the dental elevator. It can remove the teeth very easily. But sometimes for some difficult surgery, especially for example for some difficult third molar tooth removal, maybe the tooth it will lie down like this way, and sometimes at the root of the teeth there may be some nerves or blood vessels which is very close to the root, and sometimes it is very difficult to remove out. Then we can use the Piezo surgery. We can use the Piezo surgery to to cut the bone and to release the force. So after we use the Piezo surgery, then we can use the dental elevator. It will be more easy and it will save some time, because we know, for example, let me show you here. I'll show you with this thing. You can see, imagine this is the teeth and this is bone. If we are going to use the dental elevator, you can see here directly, you can see will work like this way. You can see there will be some damage to the surrounding bone, and sometimes if the tooth is difficult to remove, we have to repeat again and again, and sometimes maybe even we will use the dental elevator with violence. So it will be uncomfortable for our patient, and it will cause some damage to the surrounding bone. And what's more, you can see here, if imagine this is the root, if we are operate again and again, if the nerves or blood vessel is close to the root, you can see here, the root will go here and there, and it will increase the risk of damage the surrounding blood vessels or nerves. So that's why. And if we are going to use a Piezo surgery, you can see here, we use this tip to move between the teeth and the bone. And once the teeth it is loose, then we can use the dental elevator more easily to get out the teeth, and it will reduce the risk of damage the surrounding nerves and the bone. So that's why we use the Piezo surgery, to make the tooth extraction more safe and more gentle for patient, especially for some difficult tooth extraction. So I have explained why we use the Piezo surgery, and we also have to know how to communicate with our patients. Okay, now imagine you are a customer and you come to my clinic, and after CBCT checking, and you have to remove these teeth, these tooth. And how should I talk with the customer? Okay, so I will talk in this way. For example, Mr. and Miss, you can see here, you can see the CBCT picture. We have to remove these teeth, and now we have two ways to remove these teeth, these tooth. The first way, we will use the traditional way. We maybe use the air turbine handpiece and the dental elevator and the dental forceps. That's a traditional way. And maybe we'll charge, for example, we'll charge $50. And except this way, we have another way. We will use a Piezo surgery for tooth removal. Compared with the traditional way, if we use the Piezo surgery, it will be more safe and it will cause less damage to the bone, and you will feel more comfortable, and you will recover more quickly. And if we are going to use a Piezo surgery, we will charge maybe $20 to $100 extra. So we just leave the question to the customer, and we offer more options for our customers. They can choose use the traditional way, or they can choose use the Piezo surgery. They can choose. We don't force them to use the Piezo surgery. We just offer our customer a better option for them to choose. Okay, so if the patient, and we'll talk with our customer, if they want to get less damage, and if you want to recover more quickly and feel more comfortable, they can choose a Piezo surgery. So in this way, we will provide a better option for our customer. And if we don't have the Piezo surgery, we will only have this way. So this is how we communicate with our customers. If you buy a Piezo surgery, you can offer a better option for your customers sometimes. Okay, so that's the whole introduction of Piezo surgery. We have talked about the device setting and tip choosing and operating and how to communicate with our customers. And thank you. That's all parts of Piezo surgery.